Right, Kevin.
Good morning. I want to welcome everybody to the Wednesday, September 7th, 2022 meeting of the City of Charleston's Health and Wellness Advisory Committee. Hope everyone had a good Labor Day weekend and back in full force now. I know it's a busy time. I appreciate everybody being here, being on here and contributing your time. I know you're all very, very busy, and we value your time and your contributions to this committee. So thank you very much. So we will start with the approval of minutes for the March 3rd, April 6th, May 3rd, June 1st, July 6th, and August 3rd, 2022 meetings. And I hope everybody had a chance to look at those. Paul did a great job of and a lot of work getting those minutes together. So thank you to Paul. But if I can get somebody to make a motion to approve those, I would appreciate it.
Motion. Kevin, just one note before you do that. There was one little change that Nick Osborne with the food bank helped me identify. I said they were not in a community. They are actually in the community doing what the work that we're talking about. That was easily corrected.
Did I hear a motion to approve?
Yes. Yes, that motion approved.
Okay.
I second that motion, Carolyn Murray.
Thank you, Carolyn. All right. All in favor, please say aye.
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 And those minutes are approved. So thank you very much. So we'll move right into opioid settlement fund. I'm going to call on Paul Wieters, please.
Good morning. I want to try to make this
Paul, Mayor Tecklenburg was trying to get our attention, I believe.
okay.
So, Paul, if you don't mind, just before you start, I'll be very brief. I just wanted to share with everyone that the city of Charleston did participate in one of the opioid lawsuits, which was settled recently. And the payments that we will receive will be over, I understand, a 15 or 20 year period. The initial year is going to be, I think, well over $1 million. And then it will go out over time with subsequent smaller payments. The county and some of the other jurisdictions regionally are receiving funding as well. And so what I would like to ask y'all is to consider any recommendations that the city may consider for spending these funds to help address opioid addiction and treatment for addiction. I think the direction that I personally believe in, because addiction sees no jurisdictional boundaries. I mean, someone who's addicted doesn't care whether they're in the city of North Charleston or Mount Pleasant, is to try to have a regional approach. But there could be specific things, of course, that we would recommend for the city of Charleston, as well. So anyway, I just, with that little prelude, I wanted to ask y'all's consideration and please share any recommendations after y'all think about it back with us. Paul?
Thank you. Oops, I pulled up the wrong one. Got off target there. I just really wanted to I'm sorry, let me get mine up. I just wanted to really just, what the mayor said is could have taken my whole talk right there, but I just really wanted to just talk about the opioid settlement and just go through what we know of how it came about. That it was there was a larger one handled on the national area that allowed the states then to set it up. So in the state assembly, the House has a bill, Opioid Recovery Act, which they created the South Carolina Opioid Recovery Fund, which creates the Opioid Recovery Fund Board, and which also has the stipulation that bars future claims by state and local government. The settlement on February 25th, 2022 that basically it was a 26 billion settlement with three of the nation's top wholesale drug distributors, America's Source Bergen, Cardinal Health, and Mescons, and then opioid manufacturer Johnson & Johnson. 52 states and territories and thousands of local governments across the country signed on the agreement and made it possible for all of us on behalf of more than 3,300 community clients, state attorney generals. In addition to that, our Attorney General Alan Wilson worked with South Carolina counties and eligible municipalities to allocate more than $360 million coming to South Carolina over the next 18 years. Through an agreement reached by Wilson, 92% of the funds go directly to address the opioid crisis, and a majority of these are set aside for all 46 counties, 43 eligible municipalities. And then what's key in that whole area too, there's also 100 million that would be available for disbursements such as nonprofits, hospitals, state agencies, and others to work to help to address the opioid clinic or epidemic. So again, in that settlement, what Alan Wilson set up, the Attorney General, Charleston will receive about 2.3% or just over 8 million over that 18-year period. And the mayor already outlined of some of how that money will be flowing in. The county will receive 3.8% or just over 13 million coming into to the county also to be used. So, and that's only Charleston County. I did not figure out what Berkeley County was getting on it as well, and what our partnerships up there go to. The general areas of focus for this, the core abatement strategies, I believe they have to really focus on 4 of these main core abatement strategies, but you can see where the focus is from how the act was created or for us in our state to where it will be focusing on. And then there's some approved uses you can also see on the slide. I hope everybody can see those. I can read them, but they're right there. Of which one of those at the very bottom is to prevent overdose, death, and other harms, which is where our second part of our discussion will go today. In Charleston, we're very fortunate. We have so many strong partners all working together already, but the first one is the ACT Force, which is the Addiction Crisis Task Force. That was developed, Judge Brucey Hendricks presides over the District Court of South Carolina's Federal Drug Court and the Bridge Program, which she started in Charleston in 2010. She recognized that bringing the expertise and resources of the drug court, treatment programs, medical community, and law enforcement together would significantly enhance the response to individuals with substance use disorder. She learned of innovative work that was going on in Arlington, Maryland, and she reached out and brought some of that information back, and over the last 3 years has shepherded the Addiction Crisis Task Force, consisting of law enforcement, public health, treatment, emergency medical response, school districts, and many other organizations to reduce the incidence of overdose, injury, and death. The city of Charleston and our police department have been active leaders in the ACT Force, and the successful submission of a grant recently has resulted in additional resources being brought to Charleston County to help in these efforts. Local law enforcement has resulted in the formation of a quick response teams consisting of trained law enforcement personnel and individuals in recovery for several years. And then also Judge Hendricks, in collaboration with MUSC and the College of Charleston, last spring held a leadership to host a 2022 Charleston Summit on Addictions Response. That is a big player that probably we're a leader in a lot of areas in our state and our country with having such a group already in existence to be able to help lead us in this discussion and going forth with the grant or the summit, the settlement funds. But we also have another strong player in the Charleston Center that is a really we've had them talk to us so many times, but they are really the link that ties a lot of the partnerships together. I did want to highlight some of the CPD's efforts that I read about in newspaper over different times, but in 2016, our police department became the first in the Low Country to train officers and supply them with Narcan to treat overdose victims before EMS arrived on the scene. This additional tool has greatly improved the chances of survival of an overdose victim. And then again in 2020, there were 13 total incidents in which a Charleston police officer administered Narcan. When officers respond to an overdose call, they are equipped not only with Narcan, but are able to provide a Pathway Initiative resource card to the overdose victims and or their families in an effort to have victims seek treatment options and obtain Narcan to have on hand should a similar arise. It's important, again, for us to realize that the settlement money coming in here is the foundation to make sure we continue and grow programs such as this. In the state has published from Deodos, and I'll give you this link, I'll send it out to you, but this document here is a PDF document. It sort of describes everything about what's going on in the grant and what's eligible and the work that can be done with it. So I'll send that to you as just a link. I had mentioned Charleston Center. I just wanted to show you some of their state partnerships that they have been working with and helping to go through our community and what the different things that they do, as well as some of their local state partnerships, that how they connect in so many different areas in our community, working with our police system, through the jails, through the court systems, through law enforcement, through community action, behavioral health, criminal justice, public health, through state house appropriation, through public health, just a whole host of ways that they're engaged in trying to help in this solution. And working with ACT, working with our local law enforcement, working with leaders like Mayor Tecklenburg and our city council, and working with in the city, working with our group, the homeless commission, the mayor's homeless commission, as well as our community health and development. All of those areas, our housing and community development, all of those areas are very impactful to any efforts we make in the city. So just wanted to give you a very fast, quick, brief overview of the settlement and remind you that it is bringing some money into the city, and it does have a specific purpose. And as the mayor says, we don't know what that plan looks like. I will say that what I've heard is they've already been out visiting other cities like New York City and finding best practices, looking over on the West Coast of how people are spending their settlement money and what kind of connections they're making to bring all that about. I look for this being a very robust discussion over time, but again, as the mayor said, it's not just our law enforcement or our homeless group commission pulling stuff together. It's about a community talking together and working together and thinking more than just one little element of the Charleston County area, thinking of our city, but thinking about all the reach that we have on a metro area and how we can best serve it all. So with that, I just wanted to introduce you to it. I'll share these slides with you so you can see it, and that link to the Deodos document that will give you a lot more detail. But just want to throw it out there. And Mayor, I didn't know if you want, or Mike or Kevin, if y'all wanted to add any more in.
Councilman Seekings?
I just have a quick question, Paul or the mayor, if you know, are we the only city as opposed to county in the Low Country that received funding, or did Mount Pleasant and North Charleston get some funding too?
I'm pretty sure North Charleston did. I'm just not sure about Mount Pleasant. As Paul stated, there were, 43 cities statewide that qualified.
Mayor, the reason I asked that question is you made your preliminary comments and talked about this would be something that would be natural to pull into a regional approach. And I 100% agree with that.
Yes,
And
sir.
it seems to me if we talk to Mount Pleasant and North Charleston, along with the county, the bigger the pool, the more the resource and the more the cooperation, the better off we're going to be in this area. So, sort of preliminarily, that would be something I would encourage if we can do it, is to see what we can do to pool resources.
Absolutely. No, it should be a regional plan in
Yeah,
mind.
totally. Great, thanks. I guess we can find out, right? If Mount.
We'll find out. Yeah,
Great.
absolutely.
Great.
Mike, in that document that I gave you, very near the very end of it, there's a list of all the cities and counties that are that got money, and
Okay.
I will. It tells the percentage and what it goes on, but I think it makes, yeah, the city and county. And to answer your question, North Charleston, yeah, Mount Pleasant got money, North Charleston got money, Somerville got money, I think Goose Creek got money, and I don't know about Hanahan, but all of those definitely got, Hanahan got funded as well too.
I mean, Mayor, this seems like a great place to start with a model regionally to address health issues like opioids. And, when we talk about health disparities, that's regional too. I mean, we can use this as for a number of different positive outcomes, I think.
I agree. Absolutely.
Okay. I'll go back to mute now. Thank you.
No, it's good.
Meredith, did you have something?
I was just wanted to add in the hospital side of it. I'm sure MUSC is doing the same thing. Roper St. Francis has pushed for a grant as well to get doses of Narcan that we could distribute for our chronic pain clinics, and also to our teammates and to the community at large. And like the mayor said, this is not a boundary thing because somebody that's overdosing does not care where they are. And whether it's accidental or something that they wanted to do, this is something that we all need to grasp and take care of. And we're trying to get Narcan here. I'm a licensed Narcan instructor as well, and I teach people in the community. And we actually just had a life saved in downtown Charleston because one of our nurses had the doses and was able to help someone until police and EMS arrived, a young man. So this, I'm glad this is all coming through. I'm glad this is coming to fruition. We all need to take part in this, and hopefully with our hospitals, we can get what we need so I can actually have more Narcan, because I know that the Charleston Center is amazing. I've worked with them in the past, but now since this is all coming into play, every group now has to account for. So the hospitals are going to have to start to get their own from this, from the monies coming in. So separation and getting the money and what to do with it, like you were all talking about, needs to be taken care of. And as long as we can, all the municipalities can work together. Sorry, that came out wrong. As long as we can all work together and get this out there and get these doses. Obviously, Narcan is a huge Band-Aid. It doesn't fix the issue. Training and help with these patients fixes the issue, so they can stop the addiction. That's the end game. But the Narcan is a very necessary Band-Aid to stop deaths. So hopefully this can happen sooner than later.
Thank you, Meredith.
So if I may add, you mentioned, Paul, the statistics from the Charleston Police Department. I also got a shout out to the fire department. They're fully equipped and trained with Narcan and have been actively administering doses. I'm sure Katie's going to share with us in a few minutes some statistics about all this, but no surprise, numbers are up in the region and in the state for overdoses and deaths from opioids, and it's really a scourge. And I hate to say, but I think our statistics per capita, in the Charleston region are pretty high compared to the rest of the country. So it's real, it's here. And, I think we're all on board that a regional approach makes sense. We want to be able to use these funds very wisely. It's clear, Charleston Center, as you mentioned, will be a key component of anything going forward. And they're relocating to a new center right up in North Charleston on Rivers Avenue. And they're going to expand their number of beds and capacity up there. So it's really a kind of good timing for all this to come together.
Thank you, Mr. Mayor. And I know we have Louise Haynes from MUSC on with us as well. And I know that she is short on time, so I don't want to put you on the spot, but want to give you an opportunity if you'd like to speak with us.
Sure. Well, thank you for inviting me to attend the meeting today. And as everyone has said, yes, this is, we see the numbers just continue to go up in terms of overdose and the terrible impact on our community. And we know that for the last few years, the problem has been largely driven by fentanyl in terms of the deaths. And so we're at MUSC, we're involved with some research on overdose prevention, a multi-site clinical trial across the country. And we're learning a lot. And a lot of the assumptions that we had going into doing that, we've learned are wrong. There are a lot of people that are overdosing on opioids who didn't even know that they were using opioids and do not have an opioid use disorder, but they're still dying from their overdoses. So there's a lot to learn and a lot that we can talk about. And so my interest was really just to be part of the discussion and to help us think carefully about how to use this funding that's coming our way. It's an opportunity for us to do some things that we haven't been able to do before. So thank you so much for including me.
Thank you very much. Paul?
Kevin, I did. The mayor said the stats that we heard the other day. In 2020, we had 147 overdoses in Charleston County. In 2021, I think it was 222. The normal percentage for states is about 31%. South Carolina is 51%. And Charleston County is in the top 5 in the country in overdoses, is what was said to us the other day. So those numbers are the ones that really just jump out at us.
Thank you, Paul.
Katie's got the screen.
Thank you, everyone. Yes, I feel like I'm not necessarily the right person to be speaking on this. And I really appreciate what Paul and Mayor Tecklenburg and Meredith and Louise have already said. I do want to introduce Louise Haynes for anyone who doesn't know her. She is on faculty at MUSC in the Division of Addiction Services in the Department of Psychiatry. And she and I began having a conversation not very long ago about harm reduction, and that the importance of harm reduction being part of our addressing opioid overdoses and substance use disorder. So I just wanted to take a few minutes today, and I want to give Louise credit for these slides. Please chime in, Louise, and I'm glad that Jennifer Roberts is on as well. And yes, of course, Charleston Center is a very important player, but just wanted to introduce this because we have heard some talk about Narcan or naloxone, and that is one aspect of harm reduction, but there are others, and this is an area that I think that there's much room for growth in the Low Country as part of the response. And so I will just move forward. I can figure out how to do that. Let's see.
Katie, I did want to just mention quickly, I am going to have to jump off in just a few minutes, and I apologize for that. So I will disappear probably in the middle of your slides.
That's okay. I knew you were leaving, and I appreciate you joining for the time that you had. And we'll certainly bring back questions that I'm not able to answer. So we've been talking about this, and right, Mayor Tecklenburg knows that I always come with some data. And so this really shows that the synthetic opioid fentanyl is largely responsible for our increase in overdose deaths, really starting around 2014 and continuing on today. According to a recent blog post from the director of the National Institute on Drug Abuse, which is part of the NIH, opioids now claim 188 lives in the United States every day. These are some of the headlines that we saw over 2021, and I think that sort of top left one shows that this is a health equity issue, as Councilman Seekings mentioned. From 2019 to 2020, the total number of opioid-involved overdose deaths in South Carolina increased by 59%. And that shows that I feel like this is, one of the, that's why it's not only DEODAS, or it's not only mental health. It's not only our academic institutions. It's not only our first responders. It really needs to be sort of all players at the table. And I think this committee can really be a leader in helping to make that happen. I think of four pillars when we talk about responding to the overdose crisis. And those include prevention, harm reduction, treatment, and stopping stigma. And really, harm reduction addresses, it is one of the pillars, but stopping stigma, I think, also is very much addressed with harm reduction methods. We must work together to remove the stigma associated with substance use disorder and overdose. Sarah Goldsby on Overdose Awareness Day last week said that people can and do recover from substance use disorders and go on to lead healthy lives. But that only happens when we remove the stigma associated with substance use disorder and overdose and are able to walk with those in our community who are trying to get better. So what is harm reduction? It's really a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. These approaches have proved to prevent death, injury, disease, overdose, and substance misuse. And harm reduction is effective in addressing the public health epidemic involving substance use, as well as infectious diseases and other harms associated with drug abuse. In the public health community, we call this a syndemic, really when two or more epidemics interact synergistically to produce an increased burden of disease in a population. And here, really, harm reduction addresses substance use disorder, as well as the epidemics of HIV and hepatitis C that we see in our communities. Specifically, harm reduction services can connect individuals to overdose education, counseling, and referral to treatment for infectious diseases, as well as their substance use disorders. Yes, providing naloxone to individuals at risk of overdose or to those who might respond to an overdose is part of this. And we are doing a good job with our police and fire department, as well as getting naloxone into the hands of community members, as Meredith was saying, that can make a difference, into the hands of loved ones, friends, and family of those who are using substances. DHEC is a part of this. DEODAS does send us the naloxone that we then distribute to our first responders in the neighborhood, but we could do more to be getting naloxone out. We could improve access further outside of our first responders to have it more available in our community. Harm reduction also lessens harms associated with drug use that increase risk for infectious diseases, as I said, like HIV, viral hepatitis, bacterial, and fungal infections. And it reduces infectious disease transmission among people who use drugs by improving testing as well as linkage to care for these infections. And I think as important as all of those things are, it does help reduce stigma associated with substance use and co-occurring disorders. It provides a philosophy of hope and healing by utilizing those with lived experience of recovery in the management of harm reduction services. And it connects those who've expressed interest to treatment with peer support workers and other support services. So I hope that as we begin this discussion and continue our efforts around prevention and treatment, which are so important and which we have been working hard on, that we will begin to consider harm reduction not only with naloxone, but through other methods as well in this discussion. So thanks again to Louise, who had to drop off, and Jennifer or anyone else, if you have anything you'd like to share, I would love that now.
No, that's all great information, and I do think that we have a lot of things in the works in our area to work together and to try to reduce our numbers. We don't want to be first in this or top 5, you know. So I think it's really good information.
Thank you very much.
Absolutely. Paul, I never know how to stop sharing my screen, so hopefully you can help me with that.
And while Paul's doing that, just to bring to your attention that he put a couple of links in the chat in case you didn't see that. So we'll move on to our community health update with Dr. Richardson again, if you would, please.
I feel like I'm dominating the conversation today. My apologies. But we do, unfortunately, still have COVID amongst us. We have seen a slight decrease from last week prior to the week before, about a 5% decrease, and that is true in Charleston as well. We are now in the medium community level as far as COVID in our communities, and the sort of guidance for the public around that says if you're at high risk for severe illness, consider wearing a mask and taking other precautions. When around others, stay up to date with COVID-19 vaccines and get tested if you have symptoms. So the big news since we last met is the introduction of the bivalent vaccine for COVID. So that includes the original vaccine formulation as well as an Omicron subvariant for BA4 and BA5 component as well. We're expecting that. We've already received some of our shipment at DHEC. Hopefully our partners are also receiving it this week, and we'll be ready to begin administering it at the end of this week or shortly thereafter. The recommendation is to wait 3 months after an infection and to receive that, or 2 months after a prior booster or the primary series. There's some data saying waiting around 4 months is actually ideal. And so for those who are sitting sort of close to that, it's probably worth waiting an additional couple of weeks if you did receive a booster recently. Still around 88% of our samples nationwide are the BA5 subvariant, so of those sequenced of COVID. So we do believe that this booster is worthwhile really for anyone 12 and over that meets those criteria. It's both Pfizer and Moderna, and appointments can be made just like they have been previously with our healthcare systems, with our pharmacies at DHEC. And so that is expected to be available within the coming days, and do recommend that as we go into the fall where we are concerned about a possible future surge. So that's my COVID update. I'll move on to monkeypox or mpox. We are continuing to see cases in South Carolina. We've had 119 total, 26 of those in the Low Country region. And a few changes we've seen here. We've started giving the vaccine called Jynneos intradermally. Sort of like a PPD is given to test for tuberculosis. That allows us to stretch our supply of the vaccine. And the eligibility was then able to be sort of widened given that change. And now any men who have same-sex loving relationships with other men, as well as anyone on HIV PrEP. So pre-exposure prophylaxis for HIV are now eligible for the Jynneos vaccine, along with anyone identified as a close contact of a case. So those vaccines are still available only at DHEC as of today, but soon the Ryan White Wellness Center with Roper St. Francis, as well as Truesdale Medical Center with Palmetto Community Care, will have vaccines available as well. And we very much appreciate their partnership in helping us to reach the community that may be higher at risk. For appointments at DHEC, the Caroline, which is how anyone gets appointments for anything at DHEC, is the way to get an appointment for the Jynneos vaccine. I also want to put in a plug for a virtual town hall that I will be participating in on September 14th from 2 to 3 p.m. The Medical University of South Carolina's Office of Equity is co-sponsoring that with us. Dr. Scott Curry, who's an infectious disease specialist at NUSC, and Dr. Linda Bell, our state epidemiologist that many of you may know from her leadership during the COVID epidemic, will be joining me for that. And that's really open to all in the community. Paul will share the link. There's a QR code in the bottom right corner. You just use that to register. It is free to register, but please do so. And there'll be a way to join privately if anyone doesn't want their name used, and there will be sort of a chat that questions will be able to be asked. And lastly, I just want to give some kudos to our Fast Track Cities Charleston initiative. We will be, Shauna Hasty, who's our preventive health social worker, will be going to Seville, Spain in October to present on our work as part of their yearly conference. And she'll be presenting on our The Future Is You billboard campaign that happened last year, was developed the year before with some outreach funds. Billboards are along 526 and 26, really over sort of December to February of this year. And now we're working on sort of the next step of that campaign, which will likely be a social media outreach, either through Facebook and Instagram or potentially on some of the dating apps that are used in our communities. And The Future Is You really looks back at U equals U, or undetectable equals untransmittable. And again, we were talking about stigma around substance use disorder. This is really addressing stigma around HIV. So I hope that perhaps Shauna will be able to come next month and present her presentation from Seville and share with us some of the feedback that she received, and the kudos to Charleston and the work done here on addressing the HIV epidemic, and worldwide press for that coming up soon. I think I'll stop there and happy to take any questions.
Great. Thank you, Dr. Richardson. Paul? Paul, we can't hear you. It doesn't show you're on mute, but we can't hear you.
Okay, now we'll try again. The new vaccine that came out, could it be substituted for a booster for Pfizer or Moderna?
Yes, in fact, the original formulations of Pfizer and Moderna are no longer sort of FDA approved. So going forward for boosters, it will only be this bivalent vaccine available. For the original, for anyone who hasn't had their initial 2-dose series, the original formulation will be used for that. But anyone getting the booster, Pfizer, Moderna, going forward, once it is available, which I think it will either be the end of this week or early next week, it will be the bivalent option.
It may be a little early to ask this, but any updates on the flu or flu vaccines?
That's a great question. That actually was on my list, but I thought that I was waiting for someone to ask. So we do expect the flu vaccines will be available in the coming weeks, both at pharmacies and doctors' offices, as well as at DHEC. We do not yet have ours at DHEC. We will again be working with schools across the Low Country region to provide flu vaccines in our schools, but Charleston County School District actually now has the ability to provide their own vaccines. And so this year, for the first time, Ellen Netz, who's the lead nurse there at Charleston County School District, and her team will be doing their own school-located vaccine clinics. DHEC will work with charter schools and private schools who may not be covered under Charleston County School District. We will have community clinics, but there's not yet a schedule for that. But we definitely will recommend, as we always do, a flu vaccine for everyone. We have seen some evidence out of the Southern Hemisphere that it has been a severe flu season. We've been very lucky over the past couple of years during the COVID pandemic that we have not had severe seasons, but we certainly want to be prepared with vaccines in the coming months.
Thank you. Mayor Tecklenburg.
Thank you. And thank you, Dr. Richardson, as always, for your great updates. I did want to share with everyone just a kind of a milestone in a way. And coincidentally saw an article this morning asking the question, you know, is COVID done or will it go away? And it said, sorry, no, it's just going to be a part of life for all of us. And we'll get used to, just like we have with flu shots and flu vaccines, I think COVID vaccines will be changed year to year and over time. And if you're at risk, you probably should continue to get boosted. But anyway, the milestone is we got our 10-day notice from MUSC last week that they were going to give up our free space we've been providing them over at Lockwood, the former DMV headquarters, that they've been open now well over a year. I'm not sure when they first moved into there. I'd have to go back and check. And I'll ask them when they close out. But I bet they are approaching 100,000 doses vaccines that they administered at that location. We thank them for that incredible service they provided. I know many others provided services over the last couple of years, but that was a partnership with the city, and you know, an important one to be able to get the vaccine out to folks at no charge. So if you want one last booster from them at an easy place, I think this is the last week they'll be open over there at Lockwood.
Thank you, Mr. Mayor. Anybody else on this community health update? All right, well, I'll move on to other community updates. And I know since we met last, Charleston County Schools has been in full force. So if she would, I'd like to call on Maggie to kind of give us an update from Charleston County Schools, please. Maggie Dangerfield.
Hi, everybody. Thank you so much, Councilman Shealy. Yes, we are in full force. Really exciting to have all the students back in our buildings. Our first day was August 17th, and then the following week we had our Head Start and CD students do a staggered entry. So we've got all students in the buildings. I believe we are past our just checking before I say this. We are past our 10-day count. And just kind of in the realm of the community health update piece, we have restarted the COVID-19 dashboard that we had going for the previous 2 years that are tracking the number of positive cases in our schools. That can be found on our website. If you just go on the site and actually Google COVID-19 dashboard, that's not showing close contacts or anything like that. This is just the number of positive cases. And we are working to update that daily. So we are well into our first quarter, and that will conclude, I'm looking at my calendar, on October 19th. And yesterday, actually, we had the release of our SC Pass and SC Ready data, which was really exciting. Some highlights from that in particular are that we were showing that we were outperforming the state average in all of the test areas, including SC Pass in science, SC Ready in English language arts, and SC Ready in mathematics. And about nearly 52% of our students scored meets expectations or exceeds expectations on our SC Pass, which is close to 6% higher than the state average. Additionally, our students also improved their overall average by more than 4 percentage points from last year. Similar results on the SC Ready for ELA, and about 49% for the SC Ready Math, which is almost 10 points better than the state average. So despite the challenges of the pandemic and, learning loss that the whole nation has seen, we're still locally doing really well on the state and the national scale. So there's more information. It goes a little deeper by school level and across subgroups in a press release that we have out on our website.
Great.
That's all I have.
Great news. Any questions for Maggie Dangerfield? Thank you, Maggie. Appreciate that. And
Yes, sir. Thank you.
And I'll just kind of open it up here to community updates. If you have something, let me know from your area.
Nick.
Oh,
Yeah,
I'm sorry. I see you.
no.
I'm sorry. I didn't see it first. Sorry.
Thanks ever so much, Kevin, and thanks also Paul as well. I just wanted to let everyone know, as you probably already know, September is Hunger Action Month. And in recognition to Hunger Action Month, we have a number of different activities taking place during the course of this month. The big event that we do during this month is a walk to fight hunger. That's taking place on September the 18th in Wanamaker Park in North Charleston. So that's running from 11 o'clock to 3 o'clock in the afternoon. It's going to be a day full of fun events. We've got food trucks. And it's an opportunity to raise awareness to issues associated with hunger and food insecurity. As I said, prizes, lots of team events. There's a walk that's been planned. If you're really up to it, you can do a 5-kilometer walk. And I think it's a 5-mile walk. Sorry, I get confused with the European and the American miles and kilometers. Or there's also shorter walks as well. Paul, I'm happy to send you a flyer perhaps after the meeting, which can then be shared and gives you all the information for the event. As I said, on September the 18th, it's a day of fun out at Wanamaker Park in North Charleston.
Thank you. All right. Mayor Tecklenburg, did you have your hand up? I'm sorry. Oh, no. Okay. Kimbo Yee.
Hi, everyone. I wanted to announce an event that my department at the Citadel is putting on with conjunction with Louis Kids. It's called Big Dog, Little Dog. It is a family run program. So Louis Kids is a local nonprofit that works with families to empower them to take charge of their health and fitness. So we're doing a 8-week training program that is for families that are interested in preparing for the culmination of this training. The 8-week training begins in October 10th. It will be Monday, Wednesday nights from 6:30 to 7:30 p.m. in Mount Pleasant at Waterfront Park. It will culminate in December, I think on the 11th, with the Reindeer Run 5K. So you'll probably see a bunch of us dressed up as reindeer for that. But we have volunteers from the Citadel in terms of my cadets, We also have volunteers from CFC and MUSC. So we are putting out a call for volunteers for anyone that wants to be part of that. So Paul, perhaps I can also send you a flyer as well to advertise that call. So
Paul?
October the 2nd at Stony Field will be the Kids Run and Family Festival, starting from 2 to 6 at Stony Field. And it's going to be dry weather. The roads are going to be good and clear, and we're going to have a good activity day for family members and kids at Stony Field.
Great. Thank you, Paul. All right. Anyone else want to give a community update?
I'd like to give an update.
Thank you, Jennifer. Yes.
Yeah, thank you. So I've got some news at the Columbia level for the Department of Mental Health. We, Dr. Kenneth Rogers, our state director, has resigned. So we're going to have a change in leadership up in Columbia. In the interim, our medical director, Dr. Bank, who some of you might know, he's going to be taking over in the interim while we are looking for a new director. So that's lots of things happening in Columbia. This coming, let's see, Tuesday, September 13th. So Dr. Funsell from Charleston Center and I are an integral part of the Criminal Justice Coordinating Council. And we are going to be doing a virtual spotlight on Charleston County's behavioral health resources. It's an hour community justice forum. It'll be online. And Paul, I'll send you the flyer. I think I have the draft flyer, but I don't know if I have the actual flyer, but we'll be talking for an hour, just sharing information on the resources for alcohol and drug and mental health treatments in our area. And also talking about the new Teddy Pryor Social Services Hub. So that'll be on next Tuesday from 6 to 7. And other news is I'm going to lots of meetings about 988 because I think I mentioned to you guys before that our mental health center here in Charleston, we're going to be the backup 988 call center for the state of South Carolina. So we've been doing a lot of planning around that. 988 it's actually a continuum of care, not just the call centers. They want all states to basically have all their calls answered in state, because obviously if it's in state, we know our own resources better than somebody in Nevada. We're hoping to get online in January. The other call center for South Carolina is run by Mental Health America Greenville. And currently their answer rate was about 80% before they rolled out the 988 number on July 17th. And so now their answer rate's gone down to about 72% because calls have increased. They took about, I think, 3,700 calls in July. So calls are increasing just because of the news around it and everything. But, we're doing pretty well as a state that we already have, a mobile crisis team statewide. Department of Mental Health is trying to open more crisis stabilization units across the state. And the other big piece about 988 is follow-up wraparound care. So when people go to crisis centers or hospitals or treatment centers, that we do a better job of following up with people, trying to continue to connect them with resources, because as many of you know, we lose a lot of people that they're not interested in following up with treatment. So that's exciting. We're looking forward to taking on our 4th 24-hour program here in Charleston. But it'll be exciting, and I think our state hopefully will be able to answer all the calls, but we'll also be doing text and chat once we get open. And let's see, the only other news I have is we do have 2 fundraisers coming up for Mental Health Heroes. And Paul, I'll send you again the invites for these, but we do have a oyster roast on October 15th that is going to be on Daniel Island, and a fishing tournament on October 8th, which will be on Edisto. And the fishing tournament, I think the people who set it up are donating to 3 different charities. So I'll send all that information to you. There's also a NAMI walk on, I think, the 8th of October. I can send that out too. So yeah, it sounds like we have lots of events for the fall to look forward to across the board, and I'll keep you informed, but I'll send all these flyers and information sheets to Paul after the meeting.
Very good. Thank you so much. And Paul Wieters, please.
Hey, I wanted to introduce Lauren Greene. Lauren is a public health major interning with us this semester. She is a Charlestonian and is going to be helping us look at our health disparities in those neighborhoods that we had talked about earlier and doing a lot of work. She wants to go into epidemiology after she finishes the college and the coming, I think one more, you finish in May, I believe. And so we want to make sure that, Katie, we tie her into any work that we can to just help her get a little understanding of our area and what all the field has out there for her. So welcome, Lauren.
Welcome, Lauren. Great to have you with us.
Thank
Anyone
you.
else? Anyone else with community updates? All right. Well, if there's
Chairman,
nothing else for this.
Would you allow Ms. Lauren to make a few remarks and introduce herself in addition to the remarks Paul made? Lauren, are you up for that?
Yes, sir. Okay. Good morning, everyone. I'm Lauren Greene. I'm a senior at College Charleston. I'm graduating in May of 2023. And like Mr. Wieters was saying, I want to get into infectious disease epidemiology. And I also want to look at environmental justice as well. And I also want to get into, well, I guess I would also tie into it by environmental health as well. So I'm just really passionate about public health and I'm excited for this internship and what I'm going to learn. So.
Very good, Lauren. We are very, very happy to have you with us. All right. Anyone else? Well, if there's nothing else to come before this committee, I'm going to call us adjourned. So thank you very much for all your time.
Appreciate it. Keep it up.
Thank you.
Let us know what you think about that opioid money, if any other ideas or suggestions for us. Thank you.